Good day, everyone. Today we will be discussing about the drug named famotidine. Famotidine is an H2 receptor antagonist. Famotidine is a competitive histamine 2 or H2 receptor antagonist that selectively binds to H2 receptors situated on the basolateral membrane of the parietal cells in the stomach. This interaction proficiently obstructs the actions mediated by histamine. Famotidine inhibits gastric secretion by concurrently suppressing the acidity levels and the volume of gastric secretions. Famotidine also inhibits basal and nocturnal gastric acid secretion while lowering gastric volume, acidity, and secretions triggered by food, caffeine, insulin, and pentagastrin. Famotidine is indicated in active duodenal ulcer, active gastric ulcer, symptomatic non-erosive gastroesophageal reflux disease or GERD, and erosive esophagitis due to GERD. It is also indicated in adult patients for the treatment of pathological hypersecretory conditions like Zollinger-Ellison syndrome, multiple endocrine neoplasias, and reduction of the risk of duodenal ulcer recurrence. It is also used in management and prevention of heartburn caused by gastroesophageal reflux in children and adults. It reduces NSAIDs-associated gastrointestinal effects, treatment of refractory urticarial, prevention of stress ulcer in critically ill patients, and symptomatic relief of gastritis. In renal impairment patients, the elimination half-life of famotidine increases in adults with moderate to severe renal insufficiency, exceeding 20 hours. In patients with anuria, the half-life can extend to around 24 hours, which may cause adverse effects on the central nervous system. When the creatinine clearance is below 50 milliliters per minute, the famotidine dosage can be reduced by 50%, or the dosing interval can be extended to 36 to 48 hours. Avoid excessive or chronic alcohol consumption. Alcohol increases the risk of gastric irritation. Limit caffeine intake. Caffeine and other acidic beverages increases the risk of gastric irritation. Famotidine can be taken with or without food. As famotidine is primarily eliminated through the kidneys, consider monitoring renal function in patients, particularly in older populations. In patients experiencing GI bleeding, it is recommended to monitor their CBC, measure their gastric pH, and observe for the presence of occult blood. The side effects observed are headache, dizziness, constipation, or diarrhea. Thank you. Kindly comment for further queries and doubts.